Well, welcome. My name is Tracy Johnson, and I'm currently working at the Division of Substance Abuse and Mental Health, or the new awesome division, Office of Substance Use and Mental Health. I guess as will be in a couple of weeks. I also work with Utah's system of care, providing high fidelity wraparound, which is actually going to be in the Office of Family Health. But in both of these cases, I'm the program administrator for peer support services. Anyway, I've been a peer support for a very long time. Back before peer support was the thing, our family received peer support too. So as you've heard throughout the conference, I really love peer support. I think it's like everyone has been saying, it's something that's really going to help our community move forward. So I live in Tropic, Utah. It's a small rural town in southern Utah. There's about 500 people that live here, and I have 7 children, and they're grown. They're grown now, and I've spent time through the years helping them to advocate for services for them, as well as helping them find services in our community, and helping to build services in rural communities, services that fit the culture of our family, as well as meet our needs, because we spend a lot of time traveling for services. I see so many names on the screen that I recognized, and I'm so grateful that I wish I was there in person with you. I'm so grateful that you take time to listen to this today. One of the things, I've been working with Kim Bartley at the division or the Office of Substance Use and Mental Health, and we have been trying to, as you know, we lost our family organization that we were working with, and we were trying to rebuild some structure and strengthen and build our community with family peer support within the family peer support community. And one of the things that we're really working on is this idea of core competencies and skills that are needed to that we can continue to learn and strengthen as we continue to work in the area of family peer support. Okay, the core competencies, where there were many core competencies that were being talked about across the nation, and the Federation of Families for Children's Mental Health brought these organizations together, and they came up with these national core competencies. And the core competencies are just 5 broad categories with some skills, and these can be individualized to the community and the work that you're doing. I put the website on here if you want more information on the Federation of Families for Children's Mental Health and the work, how they brought people together and they decided on these core competencies, because they wanted a core set that were the same across the system. And they have a lot of information on that. You'll see on the Federation's website, they also have information on a national certification that you can get for family peer support. And what you do is you take a local training that teaches you these core competencies and you apply to them, and you could get a national certification for peer support. So when we talk about the core competencies, we talk about levels of proficiency, and all family peer support specialists shouldn't be expected to demonstrate full proficiency, especially in the beginning of every area of competency. Oh, dang, sorry. So, and remember that competencies is just awareness of a skill, and then knowledge about it. And then as we move towards becoming competent, so you have knowledge of the skill and then ability to perform the skill. And in these core competencies, it talks about the 4 levels of proficiency, which is just a basic level of proficiency that you're able to perform the work in the field. And then you have a working level of proficiency, diverse task, and you're constantly working to enhance your knowledge and extensive, so is able to perform the work without a lot of help from others, and then you're an expert or a leader, and then you're able to help those other new peer supports that are coming in as help guide and do troubleshooting with them as you work to help them become proficient as well. So one of the, like I told you, one of the things the Federation wanted to do was establish this national consistency and a broad consistency of domains that, so that we can allow for a national consistency and then adapt skills as needed. In fact, you'll even see as we look at some of these skills, we can choose the skills in the area that you're working on that meet our state's needs the best, and then have knowledge that each state is unique and be able to adapt these skills as needed. These national core competencies, I told you there are 5 of them: professional responsibility, system knowledge and navigation, resiliency and wellness, affecting change, and resources and natural support. And I see Heather says that there is a question, and I would love to hear your question. How much is a RAP training online? So this is core competencies for family peer support specialists. And this isn't anything to do with the high fidelity wraparound training or core competencies from that. This is just family peer support training that we're talking about. And right now the family peer support specialist training is online. So I'm going to go ahead and talk more about these 5 core competency areas. So, and to start with, we need to remember that communication is integral to all of the core competencies. All family peer supports need to have written and oral skills, person first and strength-based language skills, be able to develop rapport, have empathy, have interpersonal skills and active listening, and perspective, and be able to have perspective. Okay, we're going to look at some examples of what could fall under each of the competencies, those skills that we're continually trying to learn as family peers. So some skills could fall under more than one competency, and typically will. Just like each family is unique, each state is unique, and each state's unique. We're going to build on our state's unique needs to be able to find ways to best help us work on these core competencies. So, oh yes, so Tony's question, I was a high fidelity wraparound facilitator, which is really different than RAP. High fidelity wraparound is children's based mental health preferred practice. So I don't do RAP. I know what RAP is, but I'm not a facilitator for that. I was a facilitator for high fidelity wraparound peer support. I hope that answers your question. Sorry. Under number 1, professional development. Here are some of the skills that you might be doing under professional development. There are basic work skills, that's showing up on time, you know, being able to do emails, all of those kinds of basic work skills. You'll gain knowledge of policies, ethics, confidentiality, boundaries, professional development, and demonstrate culture humility. Those are basic skills for professional development that you can look at. Now we're going to look more about what the skills might be in that area and showing that you're competent in these areas. So you can demonstrate knowledge of these basic work skills in the workplace, and that you know the difference between peer support and clinical work, and that you practice cultural humility in the workplace. I really like that new term, cultural humility, that you are curious about and try to understand care about cultural differences, that you're able to apply those ethical standards, that you can conduct self with integrity, that you can adhere to policies and procedures, and that you can understand your personal and professional limitations as well as your biases. You can incorporate those standards of confidentiality and display professional appearance as well as attitudes, and use your self-disclosure or sharing your story appropriately, and treating colleagues and individual families with respect. System two, in number two, system knowledge and navigation. One of these core competencies is that you know about the educational system, the behavioral health system, the juvenile justice system, health care, child welfare, how to use peer support services, knowing about intellectual disabilities, that system, DSPD, substance use, social services, and legal rights and responsibilities of each support system. So that's just basic system knowledge and navigation. And I think peer support, family peer supports especially, are able to really understand these systems because we've used so many of them ourselves. Some of the skills you'll need to demonstrate in this area is just a knowledge of our educational system, as well as how to advocate within that system, knowing about IEPs and different things that you'll be helping families with. Just any basic tenets or trends around guardianships and trust, so you can give a wide variety of information or direct families in different ways to get this information, and help caregivers understand their rights and responsibilities and what system supports might be available to them, knowing the stages in the recovery process, understanding recovery and resiliency as it relates to family peer support. So in family peer support, we talk about, because we're talking about children usually, our children, we talk a lot about resiliency, because oftentimes children, they don't necessarily recover. It's more, talking about the idea of building that resiliency in our children. How to manage crises and help families do that with their children, and then demonstrate general knowledge about diagnostic and treatment options. And the skills that are that we'll use here are helping families to, oh, wait, did I miss one? Oh, sorry, I did that. Okay, number 3 is resources and our natural supports. So in this area, we can help the families we work with identify and use natural supports, access and navigate local resources, identify family strengths, their needs, and their outcomes. This is a whole lot of what a family peer support does. Help provide safety and crisis planning, and help them understand and participate in these planning process, and help build family relationships and strengthen those repair. If the family wants to work on repairing relationships and building that support system, natural support system, family support system, as well as partner with system partners to build relationships with them in treatment. There's a lot of skills in this area that we could choose from. We just want to be able to demonstrate that we know about the community resources and how to get funding for those resources. What groups are there that we could help as we build our continuum of care? Who can we partner with, and show demonstration of how to find those partners and pool our resources to build services and supports as needed. Negotiating successfully with community partners to help each of the families we work with meet their needs. As we work with the families to help them identify their goals and to plan for all the different life domains. Demonstrate ability to provide necessary information on resources and support so that families can make the best decision for their family. Help families use and identify and use their natural supports. Sometimes that is a struggle, right? So support families to access and navigate local resources and promote positive family relationship building. Create opportunities to build relationships with system partners and help family members to identify and build informal family and community supports, and then help them identify transition resources. So especially as our youth get to be transition age, what's going to be needed as they transition into those, into adult services and out of school and all of those things that come with that age. And number 4 is the skills around wellness and resiliency. So we need to be able to take a holistic approach to wellness and promote resiliency to support the recovery principles, know the impact of trauma, compassion fatigue, and burnout. Know wellness education skills and parenting skills, as well as self-care strategies for the families that we're working with, as well as for those providing the support. So for peers providing the support, those self-care strategies. Here's some of those skills. We want to use our lived experience to provide support, encouragement, and hope. That is a really big one. We want to assist families in building self-confidence and self-esteem, help families to build stability in their lives, understand a holistic view of the family's physical, mental, spiritual needs. So that whole holistic approach, right? Again, this is a skill that goes across everything, is building on those strengths and needs and looking for outcomes. And safety planning and crisis planning goes throughout, right? Helping the families to participate in that, help design those self-care strategies and help them understand the impact of trauma, promote and model resiliency, incorporate the recovery principles, and provide wellness education and reinforce parenting skills. So those are the specific ones. Affecting change. And I want to spend a little time on this after we go through the skills, but we want to build collaborative partnerships, learn how to problem solve, build relationships, advocate effectively, do anti-stigma, address stigma, talk about it, right? Be able to do systems navigation and help each of the systems understand how to better serve our youth. Work on our communication skills with professionals as well as with the families we work with and those partners at the agency level that we work at often, and have those interpersonal skills. There's a lot of skills in this area. So we're always demonstrating communication. That's a big deal. One of the things that is really interesting to me is this idea of promoting family voice and choice at all levels of the service system. So as recently, so I've been doing this work a really long time, and probably almost 20 years. And I've been a peer support in some program. And one thing I've always heard about is family voice and choice at all systems level. And I thought this was so awesome and did so much of this at the beginning when I was seeking services for my children, especially in rural Utah. And I would go every place and advocate for this. And I spent a lot of my time as a peer support doing that for my own family, as well as some of the families that I provided peer support to. And then so we started billing for peer support, right? It became a Medicaid reimbursable service. And I saw this shift, right? We did these things in our system that promoted family voice. We talked about the challenges we were having and barriers. And then as peer support became this more billable service and more specific work directly with families, face-to-face kinds of services, we kind of quit that. And I saw, or I've seen recently a big change in the work that we're doing as peers, and it feels like we've kind of quit making some of those culture changes that I really was excited about in the beginning of the peer movement when I was first involved, because there wasn't a way to pay for this or bill for this. And so this was kind of a natural thing, I think, that happened because of peer supports in the workplace with other agencies. And I think it's kind of stopped. And I really want to spend some time continuing to talk about this, and how do we have time for this, and how do we fund this kind of, because I think there's great value in this family voice and choice at all levels of the service system. And when we talk about this one, what we mean is that families are able to advocate for services for their child at the service level, you know, at the local mental health authority or wherever they're working, but also at that local mental health authority, that they're listening to the families and youth that they're serving, and they're making changes to their service system based on what they're hearing back from families and youth in the service system. And then at the state level, how are we doing this system advocacy work? And how are we organizing families and continuing to make sure that happens at the policy level, at the agency level, and at the service delivery level? So we really promote this idea of family voice and choice. So I know I kind of got off onto that, but I just have really seen that go backwards. And I wonder, as we move into this face-to-face billable service for peer support, I really don't want us to backslide, and I hope we continue to talk about that and partner with peer organizations and all kinds of organizations to make that happen. Anyway, okay, so in effecting change, we're also able to assist families in asserting their rights to meet their needs, like developing that continuum of care and have them get their needs met in a way that's effective. Support teaching and coaching to parents as they're able to advocate for themselves and their family to be able to identify what they need, and then be able to articulate that and talk about their goals that they have for their family, and not just be passive and let people tell them what to do. I think that's one of the areas where culturally appropriate services is really important. So teaching parents to say if that's going to work for their family or not. Engage with families to identify systems changes or areas of needs or issues that come up, so that they can then advocate for those changes. Strategically share your lived experience to affect policy change and assist in change as we need it. Partnering with families and caregivers and professionals to build these collaborative organizations, or whatever those look like in your community and for you. Be able to articulate the value of fostering cooperation between families and family agencies and systems. So being an equal partner at the table with system partners to make those changes. One of the things I see that happened that was so important in the rural community that I live in is, you know, we always say there are no services, right? And so how do I, as a family member, partner with agencies to build the things that my family needs, that my children needs, so that we can stay in these rural communities and have them be able to get the services they need and stay healthy. Model effective strategies for families without being directives. So don't do for, we call that do with, and then cheer on. So model for them how they can do that, then do it with them, and then cheer them on, so that they don't get, so as a peer, we don't get people dependent upon us to do stuff for them. reframe challenges and use strength-based language. So teaching those that we work with to come from the strength-based model. Be able to advocate in the solution-focused manner, mentor those that we work with, and mentor those around us, right? Build relationships that build resiliency, and master the use of interpersonal skills. So that was a lot, right, of skills. So let's, I don't know how the conversation's gonna go, but any thoughts about these 5 skill areas, these core competency areas, and then the skills associated with them, and how this could be helpful as we increase our skill level as peers? But I hope the thing that it really does, that I'm excited about, is as we move forward with this family peer movement, or this peer movement in general, that we're able to professionalize the peers, the peer movement, but also that we're able to keep those things that are so core to peers, right? This idea of the shared lived experience, advocating for change, and helping for best outcomes and solutions for families. As we move forward, and I know that the adult system as well is working on core competencies, and what are those core competencies? I think all of us will move together forward as we really start to articulate more what skills that peers are needing as they move forward. And I hope that all peers working in the field will continue to give input, because as you're working in the field, you know what's important. Anybody think these skills will be helpful? You see a couple of heads nodding. Very good. So the cool thing about this, we're going to talk about Utah now for a minute. So for family peer support specialists, so we all know, I'm assuming that everyone knows that a family peer support specialist is a parent or caregiver of a child who has been involved in the usually the behavioral health system, but oftentimes they're kids that are multi-agency involved, right? And so you're a peer to the parent on behalf of the child. That's your lived experience that you're providing. That's how, when you apply, we ask questions similar to that. So you apply, you go online and you apply, and I put the website right here for DSAMA, and the application is there. So you go down to, when you get to the DSAMA website, you go under education and just go down under peer support. There's the applications there for certification and recertification for family peers, as well as regular adult peer support specialists. So there's also training, so that's available, and when the next peer support certification training will be is all listed on the website. Okay, once you apply, you'll be accepted into the training, and then you will attend the peer support training. So most of you know that Allies with Families was our peer support training team until recently, and they went out of business. So now, currently, the University of Utah is providing the peer support training. They just hired Alicia Wilcox, who is a peer who's been doing the training, and then Kim Bartley and I are helping with it in the interim. Our goal is to get organizations ready to provide this peer training. We're going to use these core competencies to look for training. People will apply to provide training, and as long as it meets these national standards and provides training on the core competencies, then we'll hopefully over the next year get agencies that can provide the training in-house and through the certification process. But the way I understand it, at least for now, the Division of Substance Use and Mental Health, or the Office of Substance Use and Mental Health, will provide the certification and will approve the training. Okay, so once you've attended the training, you'll take a test and you'll complete with at least 80% accuracy. One of the things I'm really excited about with the peer support specialist training, as you apply, you're going to receive ongoing coaching to help you progress in your skills. So for right now, Kim Bartley or I will be assigned to each person who is working in the field and has completed the training. And that ongoing coaching will be to help you identify the skills and the areas that things that you're doing really well and areas that you want to improve skills in. Or as you know, we talked about in the beginning, the proficiency, right? So you have a basic understanding of the skills. And so through coaching, you'll be able to practice some of the skills, better understand them, understand the why of the skills, and then be able to talk to a coach. A coach is somebody who has been a family peer support specialist for over a year, and then help you progress. They'll work with your supervisor or an identified coach within your agency to be able to provide that coaching after 2 years. So a year to 2 years, depending on where your agency is, you'll receive that coaching, and then eventually the organization will take that on. And then hopefully you guys will stick around and become coaches for new peers coming in. That would be so awesome. There's just a lot of shifts, I believe, going on right now in peer support. So you're gonna, as you go forward, you know, you need to maintain your certification. You'll complete the 20 hours of CEU trainings for every 2 years. Right now, the Office of Substance Use and Mental Health is, they have a new program. It's called MLO, or My License Office. And right now, everybody who goes through the training is added to that. And then you will start receiving emails about when your certification is going to become due. You should be able to log on and get a copy of your certification, and find out where you'll put your CEU hours in, and we'll enter them in, and you'll see how many more you need. And through this certification process, or through this MLO process, you should be able to always keep up on where you are. And the state also will know how many people are certified, and and just kind of keep track of that. Because you know what, so really interesting thing that has just happened recently is we've been looking back on the family peer support process, and in 2019 we had 160 family peer supports who had been trained and were working in the field. And so we're just adding all these things to MLO and seeing who's still certified and who's not, and where people are. We can find less than 21 now, less than 21 family peer support specialists who are currently certified working in the field. And quite a few of those are also not doing full-time family peer support, or they're doing additional things like case management, psychosocial rehab, transportation, a lot of other things. So the amount of family peer support work or services in the field seems to be way less. And so the division is really looking into that to see how these trends are going. And that's one of the things I'm excited about this online process of MLO. It'll be able to keep track of trends and stuff and why that is happening. And I think with the family peer support specialist, a lot of it is probably because Allies with Families has recently went out of business. So anyway, so I did talk about this already. Each peer support will receive supervision at your own organization. And you'll be assigned a coach that will work with your organization and your supervisor as requested and as needed, right? Some of you have been a long time and you need a lot less, but I think we're just seeing a lot of changes in peer support, updating of the training materials and the way we train, keep track of things. And so I think that you'll just see changes. Okay. And again, I put the website on here so that you can go on and see anything. Hope we're going to keep everything there. I believe, as you all know, that the Division of Substance Abuse and Mental Health, or the office, is going to change over to the Department of Health and Human Services, and we'll see what changes happen with the website at that point. So Tony was talking a lot about RAP services and training, and so Tony, I hope this answers your question. So I really love the idea of RAP, the Mary Ellen Copeland, and I think that's probably the model you use. Anyway, and that's really awesome. And I hope that everybody in peer support does get an opportunity to look in and understand and have the opportunity to train in that if they want. And because I think it promotes all the values and principles we're talking about. With family peer support specialists, so I'd love to hear more about at some point about what your thoughts about this are. But for family peer support specialists, we've been involved a lot in the high fidelity wraparound. It's a national model and peer support works with the facilitator, trained facilitator, and the peer support helps the family engage in services. These are and these are usually multi-agency kids. So that idea of wrapping services around is because there are lots of services going on. And so that's kind of the evidence-based model and the way that things have been going for children's mental health. But I'd love to contact you and talk more about your thoughts because the high fidelity wraparound is typically for the really high intense kids on the high end of the service. And I think that maybe the idea of RAP could be for a less intensive service, maybe for a family that may seem less intensive. So I love that you're out there promoting that. And I hope that captured what you were saying. I appreciate that. I'm going to talk just a little bit more about coaching. So coaching is just the help for you increasing your skills and your competency and your confidence level and all of the things in increasing those core skills that you need in peer support. And one thing that I really like about the coaching is you get coaching from somebody who's been in the field for a while. So they're a peer. Oftentimes in the mental health authorities or different organizations that you're working within, you're often the only peer. And the thing I like about coaching is that you have somebody who's been in your shoes doing your job, help with the coaching. They also coaches use a method of the same we use with families is doing for, so possibly modeling skills or giving you ideas or examples of how the skills might be used, or as you're working with an individual and family that you could bring up what you're trying to do with that family, and you can get a chance to talk about and have somebody model for you how you might work with this family. And then you get to practice it together before you actually go do it with the family. And so I hope that it should bring your confidence level up. I know it's been really helpful to me to be able to do that. And so I'm not practicing on families, and that I feel a little more confident. And then the other cool thing I like about coaching is I go out there and I got this in my mind, how it's going to go with this family. And then when I come back, if it didn't go well, or if it went really well, I can call my coach and say, this is how this went. Do you have any more ideas? Or say, that is so awesome. How did that feel to do that so well? So I really like the idea of coaching and that we have that opportunity. So that's all the things I have about coaching. Is there any other thoughts or questions about this coach approach? Okay, we really want to stay connected as family peer support specialists. I don't know about you, but so I worked as a peer support specialist until about 2.5 years ago, and then started working with the Division of Substance Abuse and Mental Health at that time. And I miss working with families, but I really miss you guys. I really miss my peers and hearing what you're doing. And sometimes I don't know if there's anybody here from the state, but sometimes it's hard because it's different, right? It's hard working for the state, not seeing those families and not seeing the really cool stuff that peers are doing in the field. And it really being out there, like when I get to go out and do monitoring and hear from all of you, I get so much hope about what's going on. So first of all, thanks so much for being there and continuing to help families. I know it means the world to them. So thank you. I miss being connected with you. So we're trying to get some of those connections, right? So there's the peer support conference, which is really awesome. And I'm sad I'm not there in person. But as peer support specialist, I talked a lot about the idea of my licensing, this MLO system you're going to hear about. As it gets up and running and we continue to know how to use it, you're going to get, you should be able to get emails and information on trainings and CEU opportunities. And we'll have your contact information through the certification process, and we'll be able to keep in touch with you that way. Okay, and you'll be able to receive job postings as they come available and job opportunities as they come up. You're going to receive notification about recertification and deadlines. And you're going to be able to get information and attend the peer support conference each year and receive coaching from a peer support. Oh, I'm glad you're sad I'm not there too, because I am sad and I'm sorry. This is a hard format to not see your faces and hear about from all of you and hear your comments, because I do want to spend, oops, I have to go back. I do want to, and I know that I feel like I'm getting done really quick because there's no conversation going on. I'm half an hour ahead. I do want to hear from you in the field about, especially as Kim and I are working with the division or the office to make changes and updates in DSAMA to better support family peer support. Specialists working in the field to align with the adult peer support programs. We're trying to work to help make sure that we make changes to the rule that outlines peer support and to make the training more available, to make the process more streamlined and consistent and have a support system for you. So I would love to hear any requests or recommendations that you guys have as we make, adjustments and try and build this. Tony, one of the things, so this may answer this made me think of when I was thinking about RAP. One of the things is we have this basic family peer support training, and then some family peer supports go to work in on a crisis team or an MCOT team, or some may go to work in high fidelity wraparound. Some may work with kids in juvenile justice or DCFS, families with kids in juvenile justice or DCFS or some of these other agencies. And I only continue to see that grow, but it'd be really interesting to talk about how family peer supports may work in or be trained with RAP. Especially because one of the things that we don't have in Utah that I think a lot about is, like I told you, my kids are gone. I have 7 kids and 22 grandkids, and I have 2 daughters who have some significant mental health issues, and I have a son who has Down syndrome and some mental health needs, right? But they're adults now too, right? And I still love to talk to my peers who are raising children, or who's they're not children, so they're adults, sorry. Anyway, talk to my peers who are trying to support their adult children or adult family members with mental health needs. And so I would love to see family peer support grow to the adult system as well, so that we do that. So the family member, because I think so much of NAMI is about that family to family peer support. So if you have requests or recommendations, things we could do to streamline the process for family peer support specialists, please don't be afraid to email Kim Bartley or I at the Division of Substance Abuse and Mental Health. I have at the end our contact information, and make those recommendations. And I hope that you're all working, feeling supported out there, working in the field, and that you know that how much we support and appreciate everything that you're doing, because it's been a hard year. I think it's felt like a hard couple of years, actually. Things are changing, and I am excited throughout this conference to hear the direction that, even from the governor, right, the direction of increased pay and increased opportunities for people to receive peer support. I know that it made all the difference in our family, especially being, I don't know if any of you are from rural communities, but peer support when you're feeling alone in a community so far away from every service and support, and even other family members or other individuals, it just feels really lonesome. And I'm so grateful for my peer that I had, and still keep in touch with them, and love to see how their families are growing and their success of their youth as they've grown into adults. So I know how valuable this can be. And then through the advocacy, the things that I thought would never happen, through your advocacy and the advocacy of the others in this field, have made all the differences in the policies, the changes. In fact, even peer support, right? It was just an idea and a concept, and now, you know, it's acceptable in Medicaid and billable. And even though I did say that I don't know that all that change has been good, I think it's been good. We just need to keep our eye to the idea that we still need advocates, and that as you work with families and individuals, and they come upon barriers, if you would help them, teach them, use your skills to teach them to advocate for themselves and share their story, and find those leaders that can help them to get what they need to stay in their community and find the services and supports they need. Yep, and Jamie's clear up in Logan and feels all alone often. It can feel really lonesome. Okay, you can also, on the division's website, so we have this family peer support at utah.gov email that you can email, and you can get Kim or I, one of us will answer you. So I so appreciate your participation today, and hope to meet each one of you as I get to come out in the community again and try and meet all of you. Okay, thank you so much. And I'm going to stop sharing and let you go.